All right. Welcome, everybody. Have a wonderful afternoon. My name is Stephanie Lesko. I am the office manager at Lorain County Public Health. I am here to introduce Mark Adams, who is going to present today on the COVID-19 pandemic in Lorain County. Mark is our Deputy Health Commissioner, and before coming to Lorain County Public Health in October 2020, he served as the Health Commissioner at the Henry County Health Department since 2018. Prior to that, Mark was the Director of Environmental Health at the Canton City Health Department for 24 years. He received his Bachelor of Science from the University of Akron, his Master of Public Health from Tulane University, and completed Officer Candidate School at the United States Coast Guard Academy. As Lieutenant in the Coast Guard, Mark served with the Joint Terrorism Task Force, was deployed numerous times, and retired after 24 years of service. Mark, the floor is yours, and I'll go ahead and turn it over to you.
Thank you very much, Stephanie, and welcome everybody. It's good to have you aboard. I'm going to go ahead and start this presentation piece. I kind of like the way that this is set up because especially with this first slide right here, where I get to tell you I'm the Deputy Health Commissioner, and when they brought me on, it was to run that COVID response piece last year, and then we are still running it, and we're going to talk about that, what that means. And I get to say what I love about my job is I do love to go around saying hi to everybody in the morning and just seeing faces, and that I work on jukeboxes and vending machines as just as a hobby. It's so few people do it. So I want to talk about this thing that sometimes when I'm giving a presentation, I'll say maybe 2020 didn't exist, or because of just everything that was going on, but it did. And so this is that presentation where I have to talk about what existed in 2020. In the very basic of that, I want to go back to the science piece as to that's related to COVID and how COVID is tracked and how it moves through a community. But I need to start that with a little story about epidemiology, and that branch of medicine that deals with the incidence and distribution of disease. That helps us put together methods to find out where it's at and to help control it. So we track that disease throughout a community by identifying these outbreaks and how they occur so that we can go backwards and find the source. And I've got two little pictures down there for you, and the one to the bottom right and the one in the middle there, that is the pump in London that Dr. John Snow was able to associate with a large cholera outbreak. Out of many cholera outbreaks that were occurring in London, they really looked at it, and oddly enough, they thought that cholera was being spread in the air. They called them miasmas, and that it was by this bad air, and that something because of all the filth. And we have this idea of what maybe London looked like back then is because we've seen Mary Poppins in this Victorian age. But what we didn't realize is that, or we didn't see, the reality was that everybody's house had this cesspool in the basement, and that when you used the water closet, it just kind of went down into this ditch and then eventually made its way out into another ditch outside of the house and into the Thames. And we also then, folks there also drew their water from pumps often that were just maybe 3 to 4 feet away from somebody's front porch. And if it was a shallow well, of course, it was any type of human waste was making its way into there. And so of course, if we just kept with the science piece showing that it was this bad air, we never really would have found, Dr. Snow would have found what was really causing these cholera outbreaks. And what he used was this case map to show where all the cases were, and found that right there in the center of that map of all these cases, after talking with people, found that they all got their water at the same pump. And the interesting piece is that he did look at this bar that was down there, and he said, hey, none of the folks working in this brewery have cholera. And that's because even though they were drawing water from the well, in the process, they never drank the water. They actually just used that water in the process of making beer. And because they boiled it, they were able to end up killing cholera. So it's not that we learned a lot from that piece, and that's where epidemiology was first used. And that was the very starting place, the start line for us to be able to track and not really just guess at disease and how it moved through a community, but start making an educated process in determining where and how it was spreading. So specifically with COVID-19, we're going to talk about that movement of the virus, especially a novel virus. And, we'll go through the history of when we first started hearing about it and as it moved through the community. We'll talk about some statistics and conditions and that vaccine that we looked at in the very beginning back in July when they were talking about it, July of 20, as being that light at the end of the tunnel, and that light getting brighter and brighter as then December 23rd when vaccines started to move throughout the community. So we might remember this. We could recall what we started seeing way back in January of 2020, where January 9th, WHO, the World Health Organization, announced a mysterious coronavirus-related pneumonia in Wuhan, China. Then January 20th, CDC saying, hey, some airports are starting to screen for it. The 21st, we had our first case. And then the 31st, a global health emergency. And if you can take yourself back to that time, you remember I remember even in the public health side when I was over in Henry County was, we were watching it. We were seeing what was happening every day. We learned more about it, but we were still doing our normal duties at this time. So this is what was happening in public health department, is that we were still just being the normal day-to-day operations, but in the background, a few of us were watching this disease, learning more about it, and watching it move through another country. But then February, things really started to heat up. We saw it as it spread. You don't automatically assume with a novel virus that it can spread quickly. You watch it, you see what's happening, but then you quickly see that it is able to spread and go from human to human. And March 3rd, the governor started to, Governor DeWine came out and banned some any type of spectators at sporting events, just as a precaution. On March 9th, the first confirmed case of COVID in Ohio, and on the 14th, the first confirmed case of COVID in Lorain County. So things moved quickly. This is kind of what you can see in Ohio Department of Health's timeline map here, where you see February is just kind of sparse with information, and look at the actions that took place from the beginning of March on. That's what all those are, those orders. And as information started to pass through, and then we went to the daily conferences where health commissioners talked with the governor on Mondays, and the information was being disseminated as fast as possible, because again, with being a novel virus, new, there was very little known about it. April through June, public health, the only position we really could take is we were kind of doing some of the things we could still do, but there were some jobs that we couldn't do because a lot of things were suspended. Restaurants weren't really open. And you might recall in May, things started to open back up a little bit. And we took on a different role normally than what we have, is we took on that role of sort of a communicator, a translator of information that was coming through the Ohio Department of Health and through the federal government to all of these entities and businesses, saying, hey, here's the information we're getting. And this translates into, you might want to take these precautions or do something like this. And it became very innovative. Everybody had to rethink how businesses were opening, the restaurants going to carry out that didn't normally do carry out, and even the relaxation of carrying out alcohol laws and being able to take alcohol at the same time as you bought food. And a lot of them transitioned into doing something like that. We also worked during this time frame with the County Emergency Management Agency to collect and distribute PPE to everyone, anyone that needed it. It was a huge collaborative effort with the EMA and so many other organizations as well, and even including private folks that were out there that were making masks to give to us to be able to distribute out. July through September, we started looking at the schools and how are the schools going to get reopened in 2020, and how are they going to do that safely? What's school nursing going to look like? What are some of the messaging item or pieces that we can put together to be able to get out a safety message, to teach people about, the social distancing aspect and the masking part. Also making sure that we trying to, as much as possible, keep from having so much, the animosity piece, and just trying to be that voice of, let's try to, get together and be one Ohio. And so we really started hammering home the messaging pieces that way. And if you look at the contact tracing and the way we did case management, this is where we had if you look at July, over to the bottom, to the left a little bit, you'll see where July really didn't have a lot of cases. But it was enough, though, that finally the department really got taxed out. A lot of departments were experiencing this very same thing. As we started just seeing a bump in cases, we went, we only had really 2 people that were doing that piece. We had to bring on 10 extra employees to be able to start making these phone calls. And luckily that we had these folks on board, because if you see that where 1010 is, where that steep incline started, that is the bump that everybody throughout Ohio, the entire state, experienced, this surge that we had all the way up into cresting around the first week of December, and then finally coming down. And at the same time, vaccine push started to come out. So we really saw a drop in that piece. The questions. Also, you can follow the questions along with the previous graph. Look in the very beginning in March, where we're receiving a lot of phone calls about, hey, what's COVID? What do I need to do to protect myself? And then you see these dips, usually associated with either events going with outside. It's June, so now we're going to go outside. What do I need to do to be able to stay safe with my family? Then around July, it starts to go back down. In August, now we start going back up again about school-related items. But look at the bump in January. Now, what do you think that bump was about? That bump was about vaccine. When am I eligible to get the vaccine? Where can I get the vaccine? And at that time, the health department was the only entity that had it, as well as, well, there were some pharmacies that had it, that had special contracts with long-term care facilities. But health departments were the mass vaccinator at that point. But unfortunately, our first loads that we were getting were only 500 doses apiece. Kind of hard to do 310,000 people that, if everybody wanted it. And so communicating that information as well, we tried to, all of our messaging, when we take that information and what people are asking, is we saw that when we look at the metrics on our website, what kind of hits were happening with our website, what are people looking at, what are they searching for? And that drove the information piece that if we had a ton of people saying, hey, where's vaccine available? That drove the way that we changed that website to beef up that vaccination piece. So the turnaround on that was very quick. And I'm going to talk about how we arrange that piece, because we're looking at this as, this is on a large scale. This is a mass emergency. Not only, this is tons of phone calls. You're only looking at so many people that every department in the state has that's answering the phone. So how do you have a person answer the phone, be available, and not having a robot use or anything like that, or outside people, Lorain County people talking with Lorain County people about COVID, so that we can try to get out this calming message and say, we're going to get vaccine there. We're going to get it to you. So October through that December 2020 piece, that's where that's Lynn Sheffield there, one of our public health nurses, where vaccine came in on the 21st, and we were ready to go 2 days later with a clinic with the prior planning piece and ready to hit it. And as vaccine started to get out, we took it everywhere. Now, Lorain County it's unique. And I'll tell you, if you looked at vaccine as it's distributed throughout the state and in other counties as well, some counties we had a model like we did, and some didn't. And it just depends on the population. For us, it was really important for us to take vaccine everywhere. So we took it to 94 unique locations, unique addresses, small clinics, large clinics, everywhere we could take it. Instead of having it in just 1 or 2 or 3 locations, we took it to everywhere. And that is, and I'll talk about it here in a little bit, of why we had such a high vaccination rate, as well as always being, and from day one, in the top 10 of counties in vaccination rate per capita. And it was cold. That picture there, one of our drive-through clinics at Avon, it was definitely cold and windy that day, about 19 degrees. But you got a great staff that's out there in Lorain County that works at the health department, and after about 180 clinics, whether it's extreme weather on extreme cold or extreme hot, we took it to everywhere we could get it, everywhere they would let us put it. But how does that happen? It's a Herculean effort. How do you get hundreds of thousands of doses out there? And in this case, for Lorain County, 176,000 doses, 177 just about, out throughout the county, and the materials and the supplies. So if you're somebody that got a vaccine, you came to one of our mass clinics, you saw the number of people, normally about 35 people. You saw that there's no way we have enough nurses on staff to be able to do that. So we tapped into the Medical Reserve Corps. You're looking at bringing trailers, vehicles, food. How do you feed everybody? Because your clinics are 6 hours long, sometimes even longer. There were times that we were running 5 mass clinics in one day. February 26th, we did almost 6,000 people in one day, and we ran 1,200 person clinics at different schools. So, and how that happens is through incident command. If you're not familiar with it, I want to go over a little bit, just so that way you could see citizens on how this type of operation, how does it get out? How does it get out efficiently? It's not perfect. I mean, there were times that there was a wait line, and there are things that you can manage out, but you can't manage out everything. But what this does is when you're looking at reduced staff, but you have to take on almost this entire other business, you employ this process of incident command. And what you're doing is you're enveloping folks from all around the community that are helping this emergent need, and they filter under a incident commander, and they break out into these other positions. And so when I teach this part in a class about the incident command, is that it's for a short duration of time, maybe a year long, something like that. But I mean, you're not setting up a business forever. And so this is where we were able to bring in people from all over Lorain to work not under the health department, you're working under the incident. And when a person shows up, even if they are a nurse at another location, let's say, they might not be used as a nurse at the incident. Maybe we didn't need a nurse there. Maybe we needed somebody at the exit table to talk to somebody about vaccine. But you show up for the incident itself. And then when that clinic is over, you go back to where you were, back to your normal job. And each clinic, you'd see this chart would expand and contract each time. And this allowed people from multiple facets in the county to be able to work together, to be able to share resources, instead of all of it just trying to be lumped under the health department piece, because no health department's really set up to be able to do all of this alone. And that is another excellent piece about Lorain County. And what's so special about it is how many people, how many partners just continue to call. I couldn't even give you a number. I could give you a number of the MRC hours. Total hours of MRC, Medical Reserve Corps. These are pharmacists, dentists, doctors, and nurses that helped work the clinics. And this is as of 8/27. They worked over 3,500 hours. It approximately about $170,000 worth of activity that was volunteer, that was given to the communities. Folks gave to the community. There were so many of them, and getting to work with them. And it's possible though through incident command. So then we saw that lull in July, but now we're getting back to the school opening again. And this is what came out in late July were the two pieces from the Ohio Department of Health on an algorithm on what does the contact tracing piece look like in a school on the left, and then a guidance document on helping superintendents get schools back open. And again, we were that centerpiece where even though the information came from the Department of Health, we were that communicating piece with the superintendents on really translating this piece to them and saying, okay, this is kind of what that means, and this is how you should employ it. But then also we started seeing in July Delta variant and really starting to come through. And I then talk in August of booster doses, and you started to see this incline of cases. But the difference is right here. So if you look at our top graph, we're the top one, we're Lorain. And you see our spike, and as it comes down, you see how fast the spike was back in October, November. But if you go all the way over to June, where it starts to climb up in September, look how slow that spike is. That's driven by the vaccine rate, where it'll spread through the community. Delta's it'll spread 5 times faster. It'll still spread, but it'll spread slowly because there are fewer people to infect. And B, we're spread out a little bit more, and see that vaccine piece is kind of creating that blockade. But I also included graphs down at the bottom left and right for Missouri and for Alabama, and just showing that look how their spike resembled their first spike. Their vaccination rates were at 35% during when Delta really started to rush through, while ours was at about 53% when Delta started to come through. When we look back at it and what COVID did and continues for the relationship that we have not only with the community but with our partners, and what we've learned from it, the partnership part and just Lorain County residents are spectacular, and the want and will to volunteer was very evident. We also did see, though, this and an unprecedented amount of misinformation that continues to get spread throughout the community through social media about effects and about just this belief in a rumor, and then turns what a person thinks into that it turns into fact. And we've seen how this has divided a lot of people, and that division keeps getting worse. And that's really the opposite of what we really need to get through this part. This was an article in the Cleveland.com and the Plain Dealer, where they went through and they looked at the vaccination rate. And not only are vaccination rates per capita, but also the vaccination rate in Lorain County for marginalized populations is extremely high. We usually were wavering around number of sixth place as to maybe 14th place. That's the lowest we've been on that, and out of all the counties. And it's really been this driving factor of working with all of the churches, Spanish-speaking population, I mean, just everybody, and saying, let's bring vaccine to you. If you want it, we're bringing it to you. So the bigger pieces to take away from it is that junk science piece, where if we remember years ago, we thought the earth was flat, and tobacco industry thought we were overreacting. And I remember my dad was, everybody, you look at pictures in the 60s and 50s and everybody's smoking. And we've seen that is not actually healthy. And we looked at that. We still look at the autism and immunization piece as though, even though that article was recanted from the Lancet, and even though the doctor admitted that he made mistakes and that he lied on that data, but yet it still pervades in social media and the relationship between those two. So, what we've always tried to do with folks out there is just make sure that they consider their sources before they repost. What we want to do is make sure that they're calling us and that we can talk to them and have a conversation, and really get the right information out. And what you want to do is really just to get engaged. I do, even if I've got people that don't really, if they're not agreeing or anything like that, it's okay. I want them to call and be able to, so that way we can carry on a really good conversation. And everybody leaves after a conversation of, okay, they understand my point of view and I understand their point of view. And we also be a good advocate for good health, and join any team from the LorainCountyHealth.com, those partnerships that we have. We have walking and biking options, tobacco-free options, or volunteer. And most people just contacted us and said, how can I volunteer? And how does this happen in a public health department? And especially the financial piece was very important. So what you see here is our levy generates 32% and the grants 39%, and our fees and the miscellaneous. COVID isn't wrapped up into that piece. It's not, you don't have 32% of your money sitting aside or 39% sitting aside waiting for some disease, because there's all these other things that cancer, heart disease, diabetes, everything that we're trying to work on. And luckily, there was a financial piece that was plugged in to be able to help us respond to that. Food alone was incredibly expensive, weekends, things like that. So it was, there were 190 clinics outside of this office. So that gets to be very expensive. And luckily that piece was provided by the state and by the federal government for all of the counties of the health department throughout the state. I mean, we were the mass vaccinator. Now that we have 33 other partners out there with the pharmacies, there are multiple places a person can get their vaccine if they so choose. So I leave it open. I'm going to drop out this. I'll stop my share and go to questions.
Mark, thank you for that presentation. Looking through our chat box, we do have some questions for you.
Okay.
So our first question would be, can Lorain County Public Health require masking for our young children in the schools? And this person goes on to make a comment about young children not being able to be vaccinated, and masking and whether it works and the different things that are going on in the schools. So can you touch on that, please?
Sure, correct. It's the public health departments in the state don't have the authority to do it. So the only reason the state did it last year through that emergency order, and then through the governor and through the Ohio Department of Health. And the health department was that translation piece again, where people were instructed to call us and say, what does this mean that's coming from Columbus? That same thing, without that piece, without House Bill 22 changed the way that the governor can impose a 2-week mask mandate. But The health departments cannot do that piece. We don't have that authority to do it through the revised code or through, unless the governor was to give that authority to for us to do that. So right now it's up to the governor and up to the legislation if they wanted to do that piece. They're not doing that. So what they did is in July, when they handed out that guidance to superintendents, it was, here's this information, continue to work with your health departments, look at data, look at as much information as possible, make the determination. We recommend, this is the state speaking, we recommend that you use masks, but it's not a requirement. So when we said the same thing with superintendents, when we were working with them, this is what the CDC is saying, this is what the Ohio Department of Health is saying, and again, we recommend it, but the decision is up to you as a school.
Thank you, Mark.
You're welcome.
Our next question, if we have the Moderna vaccine, can we get the Pfizer booster?
No, they're doing studies on it, but there's nothing that says, hey, it's that you should get this one. We have Pfizer, we have the boosters that's available, and we are accepting those appointments, but nothing that's come down yet for us to be able to say, yes, if you've had your 2 doses of Pfizer, come in and get your Moderna booster shot.
Thank you. It's flu season time. Can I get my COVID vaccine booster at the same time as my flu shot?
We're actually planning clinics right now. So with the Delta piece, we're going to be having a clinic for boosters next week. So right now we're calling through those that want an appointment for next Saturday. And then we're going to open it up to the rest of the public that wants a booster shot. We're going to be doing a clinic here. But we're also doing our flu planning throughout November. And our discussion today was changing all of the clinics to flu/COVID clinics. So we have been able to successfully bring all 3 vaccines to all of our clinics back in May. We started bringing J&J, Pfizer, and Moderna to be able to offer that choice. And we did maybe 60 clinics that way to have all 3. So when we talked about it just in the last couple of weeks, we said, you know what, let's just open up. It doesn't really matter the way that we do the vaccine, the way that the clinic runs. We use the same scheduling program. So we're going to be combining all of our flu clinics with COVID vaccines, if people so choose. They can get both at the same time. The other piece to that, though, is there might be 1 or 2 locations that we reserve to the side because of size. So we may not be able to do all 3, and it might be just a smaller clinic.
Thank you for that. We did get a question through Facebook. So how is your team continuing to provide services and programs safely, even while COVID spreads?
Well, we only have on our incident command. So when we were doing clinics, we had nearly everyone in the entire department being a part of the incident command piece. Well, now we have maybe about 10 people out of 100 that are really working on the incident command aspect. So the rest of the staff have gone back to doing the regular job, the inspections, the health education piece. How we continue to stay safe in that is that we still will do a lot of Zoom meetings, although we have, as a staff, kind of opened up a little bit of going out to some locations. We still will mask in various locations, depending on each person in their whether their personal safety wills or wants are. And also, if we're in a location that says you need to be masked, we'll make sure that we're masked. And we have a very high vaccination rate. So it's as a department. And so those are the 3 main methods that we use to protect ourselves.
Thank you. We have a question about boosters. How can we go about getting that scheduled?
By calling our number. And I'm looking at if we can post that number in there, Stephanie, the number for the immunization clinic for them to schedule.
We can go ahead and do that. So when we get the number available, we'll put that in the chat for you.
Yeah, Katie's about to give it to me.
There is information. If someone does want to call the health department, they can call our main line at 440-322-6367, and we'll be able to direct you to someone who can schedule you for an appointment.
Yeah, and Katie just is putting up on the window 440-284-3206. So.
Thank you. Okay, another question came in. What percentage of Lorain County schools are full masks?
I don't have that percent because some schools are doing some full masking, some masking only with certain grade levels. So with all the school districts, and it's changed a little bit. Some of the schools have changed from where they were at the beginning of the year to where they are at now. So I'd actually have to pull them again. We talk with them on Fridays. I'd have to pull them again to find out what is new. So I don't have the exact percentage. I know that there are a few, but not a majority.
Thank you. Looking to see if we're getting any additional questions coming in. All right, we just had one pop up. Can we collect that information? It would be nice for parents to know with extracurricular activities between schools. So that would be the question about the masking piece.
Yeah, absolutely. In fact, if I could give you my email, I'm going to put it in the chat. Hold on. I'll put it in the chat so that you have it. Just email me. I've had a lot of people email me and I just send them whatever information we have that they're looking for. There you go. And then I will reply with that information.
Thank you. And we're getting some thanks. And we did get a very nice comment. Sincere thank you to Lorain County Public Health for all you have done to keep us safe and healthy.
Yeah, thanks.
Thank you for that.
It has been hectic, but it has been, the part that makes it a pleasure is I wish I could, like Stephanie mentioned, I was in the service for a long time. And so I got to see what it looked like in forward movement and a lot of the bad things. And the one thing about this piece, and even though it was hectic, and was getting to see how many people in the community kind of got together. And I'm hoping that we get back to that. I know that it's very divided, and I just hope, I wish there was something I could say to, make it all better and just kind of be all one again and not have the division that we've got. And we'll get there. I hope soon.
Another question would be, what is the health department looking forward to doing more of once the pandemic winds down?
Well, we're going back into the mass clinic mode. We're looking forward to the end of that, and looking forward to. So I had a mother pass away of cancer. I had a brother die in a car accident. Another brother die of overdose. So that really, those three things are really in line with our community health, our health improvement plan. And that's what I'd love to get back to, and really kind of working on that piece, because we still have that in our community as well. And, ending this COVID, the part of it, and getting through COVID and everybody getting through it, bringing everybody back together, and then saying, let's really hit these other things too. Let's reduce diabetes. Let's work on minority health. Let's hit these things and really make a dent in those numbers. Infant mortality, we've got to hit that one again too.
We did receive another comment that came through. Thank you for the vaccination efforts at the clinics. It was an admirable feat.
Thank you.
So thank you to our staff for that one. Looking to see if we're getting any additional questions coming through.
Sure.
And we'll give our folks who are watching a little more time to type those in.
Not a problem. And also with my email there, I'll email you back. While we're waiting, I'll give you a snapshot. Our graph is going down a little bit. So we have had fewer cases in this 7-day average. We had a couple more hospitalizations. We're up to 31. I will tell you that the hospital beds are full. I've talked with the hospitals and they are full. And as far as deaths go, here's a weird thing. We had all of 2020, we had 8 individuals die in their 40s. And in just 1 week, we had 3. I mean, it took almost 13 months to get 8, and in 1 week we had 3. That's just the thing about with COVID. I mean, yeah, I know some people have called me and said, hey, this data piece doesn't really make sense. Overwhelming. If you look at all of the data, that's kind of what there's going to be some that's bad. A lot of the majority of it though is good data. And when we look at that, that is a surprising thing to us. When we talked about it last Thursday, we thought, wow, I mean, what is the unique, and they're not all fitting that parameter of where it would affect somebody. And that's just really one of those things, because you don't know everything about this virus, that as it moves through a community, you just hate seeing those things happen. And we're just hoping that we will continue to decrease, we'll get in that wall, and that we continue to build up that immunity part, and then we move on from COVID and we get to these other things.
Looking forward to that. We did put a last call out for questions. looking to see. And if we have any additional ones on our Facebook. Looks like we don't have anything else coming through, Mark. So thank you everyone for joining us and for watching this webinar on the COVID-19 pandemic. We hope to have this recording available for you soon. So if you'd like to go back and watch it. Like Mark had mentioned, if you have any questions and you'd like to talk with us more, please contact us at loraincountyhealth.com. You can also email Mark. He put his information in the chat. It's madams@loraincountyhealth.com. And then you can also call our main line, which is 440-322-6367. We hope you have a wonderful day. Thank you.
Thank you. We'll see you all. Bye-bye.